Ladies and gentlemen, boys and girls, my name's Mel Herbert, and it's really my pleasure to speak to you. I really want to thank Jess for asking me and for CalACEP. And so Jess said, do you want to talk about maybe how COVID is going to change emergency medicine and education? And I thought that's a really interesting idea. COVID's going to change everything, everything. And I certainly have no specific insight about how it's going to change emergency medicine or education, but I'm happy to spend just a little bit of time with a few of my thoughts, because this is an extraordinary time. If you are having a hard time getting your head around this, that's normal, I think. When I talk to patients that went through the Second World War, my grandparents that went through the Second World War, actually my mother was in England during the bombings. When you talk to a lot of those people, there's this weird look they get, like, did that really happen? That I was in this world war, the entire world was fighting and people were dying and it was just overwhelming. I think that's a little bit about how we feel right now. This thing has changed everything and it's really hard to get our head around. I don't think we'll fully grasp it until years later, and we too will look back at this time going, did that really happen? It's just a little bit too big to get your head around. But in terms of how emergency medicine and education might change, here's a couple of ideas. The first one might be a little obvious, but the first one is that the textbook is dead. Now, the textbook has been dead for a while, and this is sort of one of my pet peeves. I love textbooks. I have lots of old medical textbooks from when I was in medical school and residency, and I keep them around because I just like them. I haven't had to move in 25 years, which is good. And I might have chucked them out if I had to move, but I love textbooks. But they're slow, they're expensive, they're heavy, and in a pandemic, they're completely useless. If you go to the latest, greatest textbook, there's nothing about COVID-19 in there, but we desperately need COVID-19 information. So the textbook manufacturers' profits have been going down for years, but I think this is it. I think this is sort of the death knell for traditional textbooks and traditional learning. So we started our online textbook in October of last year. It feels like forever ago in COVID years. But we created that thing specifically so that we could have a rapidly updatable online clinical reference text. And within 6 months of starting this thing, along comes COVID. And a number of us, particularly Jess and I, within MRAP said, we really should have a COVID chapter. And then we thought about it, it's like, that's going to be too much. There's so much information coming in. We're going to have to update that every day. So we went away and thought about it for another day. I'm like, well, if not us, who? So we better do it. So Jess and I wrote that first chapter, and we got some experts to help out. And we literally were spending every day redoing it and adding new information. And within days of starting that project, we had it online. And since that time, we've handed it off to new people. We've had more experts come. I actually tried to get ID experts from across the country and indeed from across the world to write it. But all of the ID experts said, I haven't got time to help you. I'm dealing with my hospital response to this thing. But it showed me that this idea of an online textbook is the only way to do this thing going forward. Because you can add the multimedia, you can add the audio, you can add the video, but you can also change the written material very quickly. And it's not just us, of course. UpToDate has resources and blogs and other places do it as well. And I think that is the future. I think the textbook as you know it is going away, and the textbook as you know it should go away. We even did live shows here in the studio based on that textbook chapter, and talk about changing medicine. We used to do live shows where if we got 500 people, maybe 1,000 people to watch a live show, that would be amazing. During the time of COVID, that first one we did, we had over 20,000 people watching in real time as we discussed this outbreak. So medicine has changed a lot. It's moved online, and education has moved online. And I don't think that's going to change because the technology, that's just where it is now. Now, the other thing that I think is going to change and should change is telemedicine. So the ER is an absolutely filthy place. I don't know if you knew this. It's disgusting. Despite how much it gets cleaned, it's disgusting. And here's an example. At County LAUSC, residents would get their PPD done at the beginning of their residency. And they did an internal survey and found that over 60% of those residents, by the end of their 4-year residency, had gotten PPD positive. The ER is a filthy place. In a pandemic, guess what? It's a filthy place. You take all of the community spread out there and you funnel it to the hospital, and where do they all come through? They come through the front door of the emergency department. And our patients and our non-patients understood this very well. And when we said stay away because there's a lot of COVID here, everybody stayed away. They were having their heart attacks and their strokes at home. It was bad. We overdid it, actually. We told them to stay away, and we should have said, please come if you're sick, but if you're not sick, that's okay. But telemedicine it's been around for a while, but during this time, we've used it an enormous amount, both in the hospital and outside the hospital. But this is where I think medicine should be going more too, because it turns out that a good history and a video camera can get you 99% of where you need to be for a whole bunch of patients. They don't need to come to the emergency department. They shouldn't come to the emergency department. And if they don't need a suture or a splint or to actually have hands put on bellies, then they probably shouldn't come. So I think medicine will change substantially. I know lots of people in private practice here in the United States, and for them, telemedicine is going to be a big part of what they do going forward. If you've got a rash or something and you want to go see your dermatologist, how much better to do it at home? Same for the emergency department. I'm not sure if this thing's really bad. Let me call into the ER, talk to the doc on the telemedicine thing, and be billed for it in an appropriate way, get fixed, not have to go to the emergency department, not have to drive, not have to take the kids out of school, whatever it is. I think you're going to see a lot more of telemedicine in all parts of the world, even once this pandemic is gone. Now, the next thing I want to talk about could be viewed as political, but I really do not mean it in that way, as in a left-right kind of way. But I think what this pandemic has shown us is that science matters. Science really matters. And we are going through a dangerous trend, not just in the US, but in other countries as well, that science doesn't matter. This anti-science and anti-scientist meme, I think, is quite dangerous. If you look through human history, other civilizations have gone through this, where groups of people in that civilization have decided that science doesn't matter and religion or other things are more important, and the two can't stand together, so we will go the route of non-science. And great civilizations have fallen because of that, and I'm very concerned that we are going through that time right now. That as we have this sort of populist uprising, for some reason, that means that people don't like science. They proclaim themselves or their tribal leaders as experts, that those people who have studied this thing for their whole lives, well, they don't really know it more than I do. And Dr. Fauci has been one of those people saying, look, I'm really concerned about this trend. You can be an anti-vaxxer. If 70% of the rest of the population get their vaccines, your kid will be protected because of them. You can get away with it when there's not a pandemic. You can be a flat earther your whole life because basically it doesn't matter whether you believe the earth is round or if it's not round. But when there is a public health and science catastrophe that we have just had, you can't ignore the science. If you do ignore the science, then people will die. You cannot proclaim yourselves or your movement as an expert in the face of something that really matters. I mean, it seems so blatantly obvious, but it doesn't become blatantly obvious until you have something like a pandemic. I would not go into the operating room and try and take out somebody's brain tumor. But that's what people who know nothing about public health have been trying to do and say, oh, we don't listen to those public health people because we know better, because we've got degrees and PhDs in fields that are completely unrelated. It's insanity. So I'm hoping that this will show that science really matters, that being science literate, just like you are, being science literate, being able to read the literature, being able to weigh the pros and cons, being able to understand a good study from a bad study, being able to understand sometimes good studies are wrong, and sometimes bad studies just by accident get it right, and that you have to have a Bayesian way of thinking about these things, and you have to have the ability to be malleable and change your response when new information comes in. We need to be science literate in that way. And that can still result in very different outcomes. And the great example is you've got Sweden and New Zealand, the public health services. If you look at their data on the public health services of these two countries, they basically agree on the science. They basically agree on how infectious COVID-19 is, how many old people will die, how many young people die, how it gets transmitted, the use of masks, and all of this stuff. They basically agree on it completely. But in New Zealand, they decided to lock down and do contact tracing and try and really damp it down, and that's how they were going to deal with it. And Sweden said, well, we're just going to do something a little different, keep it open, let the young people out there, maybe we'll get some herd immunity, And two very different ways, and I think two reasonable approaches. You could argue for both. We won't know for many years about which approach was best. It might be that the Swedes got it right, and eventually everybody's going to get the virus anyway, so destroying your economy is not the right thing to do. Maybe New Zealand will get it right. Maybe we will get a vaccine fast enough so that that suppression of the disease and the vaccination of millions of New Zealanders will mean that in the end, maybe they will be right. We won't know for years to come, but the same science resulted in two very different scientific approaches to this disease, and I think that's perfectly appropriate. We can disagree about what to do with the science, but we can't disagree that science is not important, that anybody out there can be science literate when they're really not. And finally, what has this pandemic shown me, or what has it changed? Well, I gave a talk at ACEP a couple of years ago, and I talked about the fact that in my lifetime, we had a pandemic, and we got through it, and we were scared, and every day we weren't sure whether our patients would give us this terrible disease, and it was HIV. But every day, residents and attendings and nurses across the country came to the emergency departments when we were seeing tremendous numbers of HIV-positive patients, and we looked after them. And now I see this pandemic and I watch a whole new generation of docs and nurses and healthcare professionals every day go to work, and they're afraid. They're afraid that the disease that they're trying to help with their patients could infect them, could kill them, could really hurt them and their family. They could bring it home to their little kids. They could bring it home to their grandparents. They're afraid, but they go into work every single day. They wear N95 masks for 12 hours at a time. When they take it off, they pull the flesh literally off their skin, and we've seen the pictures of these people over and over again. They keep going in, and the world has seen, appropriately, the people that are working on these front lines as heroes, because they are. You know, there's two types of hero. There's the accidental hero. That's the person who's walking past a burning building and sees that there's somebody in the building and jumps through the window and pulls the baby out of the burning house, and that is an accidental hero. They didn't wake up wanting to be a hero, but in that instant, they did an incredibly brave thing. But there are people that have argued that even more powerful than an accidental hero is something that some people call the deliberate hero. The person who has put themselves continuously at risk, knowing the dangers, and have gone back into that building over and over and over again. And the people that are working in the emergency departments and throughout the healthcare system right now, I tell you, are deliberate heroes. They're afraid. They're afraid that they're going to get this. They're afraid that they're going to get sick. They're afraid they're going to look like that 200-pound, incredibly muscular nurse who got this disease in his 30s, who literally came out of the hospital barely alive, a 90-pound weakling, almost dead. They're afraid of that, but they go to work every single day. They've been called heroes because they are. And I think many of you that are listening are students and residents, and you are thinking about emergency medicine, or you're in emergency medicine. And it's the best reason to do emergency medicine, because the people that do it are heroes. They're not accidental heroes. They're deliberate heroes. And you can be one of those, and you can work alongside one of them. And there is nothing more inspiring than that. Have a great conference. Thanks for listening.